I'm Dr. Marti Loring. I specialize in trauma, how it can hurt our hearts, our minds, our souls. And there's so much trauma in society today. I would like to help you understand how OMTH, ouch, my trauma hurts, like to help you recognize that and look at different ways of recovering. We're going to talk about knowing more about trauma. I'm going to have guests for you to meet, and I hope that it's something that's meaningful in your life. Remember, OMTH, ouch, my trauma hurts. You can recognize it and be recovering from it. Thanks a lot.
So I'm Dr. Deborah Fernhoff. I'm a clinical psychologist in my, I think, 51st year of practice. So my doctorate is from Temple University in Philadelphia, and then we moved here to Atlanta in 1974. And I've thought over the years, like, why did I become a psychologist? And my parents were immigrants. My parents were both Holocaust survivors. And as I was growing up, I did a lot of translating. So not only into English, English is my third language. I learned it when I was 6.5, but also the culture, what people meant, what was going on. And I realized I think that formed a basis for helping people understand each other just by growing up and being the translator. So I think that's how I got to where I got.
Interesting. Well, hey, Dr. Deborah, thank you so much for being willing to share. I know that this is not in place of therapy, our discussion. If someone needs psychotherapy, I wish that they would get it, and that would be really helpful. But what we're sharing today is sharing ideas to help people to recognize what they're feeling, experiencing, trauma, and otherwise, and perhaps help them to understand what they're coping with in today's world. And some ways, perhaps it could be a little easier for them. And maybe that's a good first question. I wonder how you feel about what people are coping with in today's world and ways they can deal with it all.
So, the difference between us is you work with people who've already experienced significant trauma. I'm on the other end. I'm trying to keep people from experiencing trauma. That's certainly not always going to work because there are many forces in our world we don't control. And I'm a clinician. I see people who have sought out a psychologist for help in kind of figuring out what their next step is. But in today's world, we all live like with background radiation, and that radiation is stress. We don't know what's going to happen. We don't know how it'll affect us. We don't know how it'll affect people close to us. So the thoughts I've been working on in the last couple of weeks is how to stay sane in a crazy world. And in preparation for our talk, I came up with some ideas. They're not revolutionary. They're not a secret formula. They're things that everybody knows and everyone has known them for a long time. But sometimes we need to jog our memories and reflect on, wait, this is what I have to do to stay sane in a crazy world. So the first one I thought about was, whenever you hear something, read something, consider the source. That we are always good at urban myths, and you don't always know like what's a real thing and what is somebody's third cousin heard it from somebody in the street, blah, 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 you know. So the first thing to check is your reactivity. Don't go hair on fire. Oh my God, the world is coming to an end. It's not. So, Marty, what do you have? What are your thoughts?
I think that's really important because if we're anxious, it can be whatever we feel, we immediately
Right.
go into anxiety or fear, and to just step back for a minute and ask the other person where they might have heard about this or see how it affects our lives. May need to do a little research or ask around. I think it's a calm that's very valuable at this time.
There's a great phrase that I've learned from educators: be curious, not furious. So if you hear something and it gets your blood going, ask questions first before you explode. Like, oh, tell me more. Where'd you hear it? In what circumstance? Do you trust this person? Um, get your data before you react. And that's probably something we should do all the time anyway, that we all are knee-jerk reactive, and that works against us. It's like, yeah, get your facts, get people to talk, don't react immediately, just as a coping mechanism. But that's like number one on how to stay sane in a crazy world, which is don't go crazy to match the world.
So I can see that a pause to evaluate the information, could even prevent some stress and feelings
Right.
of trauma. That's a really good idea. What else would you recommend?
So the other thing is shrink your focus, meaning don't try to control that which you cannot control. So if there's something you feel responsibility for, but you have no control, that's the recipe for anxiety and or depression. So trying to think of a good example for that. Or do you have any thoughts about an example?
Yes, I was thinking if you hear that your or someone else's job might be in jeopardy, sometimes there are ways to give a call and check that out before reacting to a rumor, because that's very important.
I think sometimes parents have a sense of responsibility for an adult child whom they have no control over and worry themselves sick. You have no control. You're going to have to like back off, shrink your focus, recognize your child is an adult. They'll make good decisions, they'll make bad decisions. The consequences of their decisions will be on their heads. And I think for a parent, that's really hard because even if your kid is 30, you keep thinking that their decisions are your responsibility.
That makes a lot of sense to me. And the idea of trying to stay focused and shrink what's coming in and what's going out, I think is very important. I do. That idea of focus, I think, can even protect people from trauma or when they're feeling overwhelmed with anxiety,
Right.
traumatized. It can, I think, be a relief to say, well, let me see just exactly what I'm going to focus on now. Are there more ideas that you have? Because these feel valuable to me.
So here's another one that everybody knows and needs to do more of, which is count your blessings. We just had Thanksgiving. There was a little piece on NPR that was wonderful because they brought on a psychologist who does research in gratitude. And what they find is that when people experience gratitude, A, they're happier about themselves, and B, they're nicer to other people. So when you have a sense of gratitude, you help yourself, you're helping the world around you. And so it's one of those for most of us, even in difficult times, our cup is more than half full. We just tend to go to the bad because bad weighs more than good. So remind yourself, literally count your blessings. I have my health, I have friends, I have heat in my house, I have safety in my community. And maybe not everyone has those blessings, but if you do, then be sure to count them.
Oh, I think that's marvelous because I can just imagine how feeling grateful and counting the ways can affect feeling more calm and less anxious. I really like that.
All right, instead of counting your sheep, count your blessings.
And that includes relationships too, doesn't it?
Absolutely. So there's a technique I sometimes use when I see a couple where I ask them to give the other person 3 compliments a day. And it can't be, oh, you look nice. Those are cheap, right? It has to be, wow, you really helped me a lot when you put the dishes away. I really appreciate it. Or you were really good at managing our kids this evening. It doesn't matter, but it has to be a genuine compliment, and there have to be three of them. So, why is this an important exercise? Because if you're looking to pay a compliment, you're looking for the good. And when just the ordinary day goes around, you take the good for granted and the bad catches your eye. So we're all much more likely to be critical than to be complimentary. But when it's your assignment and you kind of like you want to like do well in class, then you look for things that are positive and you'll find them. Whereas the negative kind of announces itself.
I think when we're feeling stressed or traumatized, the like, I, I think there's a tendency to focus on yourself and your anxiety. And
Absolutely.
it feels to me like you're giving invitation. Look out there. Look at someone who's trying to be kind, or you might ask to do this or that. It's a whole different perspective. I think that's really nice.
Right. And to be aware, this is a little bit of a side note. I think, especially for us as we've aged and are aging, and when something in our body doesn't work well, we shrink the size of our universe to wherever the boo boo is, to wherever it hurts. And we tend to see only the pain and tunnel vision. We don't get to see the things that are positive. So I think, especially for us as we're aging, it's really important to recognize the good stuff and not just shrink our worlds down to the bad stuff.
That makes a lot of sense to me. I can see how important gratitude and being able to see good stuff and hopeful stuff really is. And I would imagine you'd get different feedback from people when you're expressing gratitude toward them.
Absolutely. Right. Because then you're like modeling behavior, you're setting a different tone. It's the power of thank you.
Ah,
No, it's remarkable. It's a little phrase, cost you nothing. Say thank you. We do that with children. We teach them to say thank you. We just need to do it personally.
right, right. So we shouldn't let stress run over the thank yous and the appreciation or
Absolutely. Absolutely.
Mhm.
Okay, here's the next one.
Okay.
It's a big one. We all know it. Don't take it personally, right? Don't make it about you. That's like a narcissist does that. Everything is about me. The truth of the matter is, very little is about you unless you make it about you. So, the one of the big books this last summer that everyone was reading in one week, I think I had 5 patients tell me about this book, so I got it. And it is Mel Robbins, and the name of the book is Let Them. Because the little thing underneath is let them and then let me. Don't make it all about you. People aren't talking to you. People are ignoring you. People are mad at you. You're inserting yourself into somebody else's life and making it about you. And then you're getting upset. It's okay. It's not always about you. I think that's probably one of the hardest things that we struggle with as individuals. We make it about us when it's not.
I think that's really interesting. I think, for example, if people feel high anxiety and trauma, they feel a lot toward themselves, you know,
Right.
not coming at them.
It's
Whereas,
all about me.
yes, yes. Whereas um if one was to just kind of step back a little bit, take a good look, maybe you're even looking at characteristics of the other person. They're coming to you, but they're not intended at you.
Correct. So it's like water off a duck's back. Don't take it personally.
I know someone who used to delight in helping people to change. That is, if someone was being a little rough, he would say, "Well, here, let me help you. Or can I get you a soda or leave an extra tip?" And then you could see the other person from their own trauma or being immersed in themselves kind of melt and be able to be appreciative themselves.
Right. A little kindness goes a long way. This is not a revolutionary idea. I think every religion, every faith has something to that effect. Be kind. And we constantly have to rediscover how true that is. Be kind. Say good morning. How's your day? Not a big thing, but it makes somebody's day nicer.
And I think it's wonderful that you think people should be kind. I wonder if we each be kind, if it has a ripple effect and perhaps changes uh, our part of society even more. There's not a lot of kindness out there sometimes.
Here's another study that I think, well, two parts of this study that I think are really lovely. And one is if someone lets you in traffic, you are more likely to let the next person in, and they're likely to let the next person in. So there you see that chain effect of kindness. And they find it like, with street musicians, if somebody walks by and puts $1 into the basket, it is more likely that the people coming after them will also put $1 in the basket, which I think is good psychology on the part of buskers, of these street musicians, because they'll have a little can with $1 already in it. So, you know, it sets a message like, yeah, other people have been kind, you can be kind too.
It's, I wonder if kindness is catching.
I think you're right. I would like to see more kindness virus in the world. That'd be great.
I think maybe kindness is one anecdote to trauma. If you're beginning to feel more and more anxious or traumatized, and someone behaves in a very kind way towards you.
That's absolutely true.
Mhm.
Right. And so this is almost the last thing that I jotted down. We live in really, really divided times. There's an awful lot of political dissent, um, and anger and unhappiness with each other. So this is a way of coping, which is never argue with crazy. If you're getting the sense someone is stuck in a certain mindset, a certain belief, don't think you're going to change them. A, it's not your responsibility, and B, it's not going to happen. So save your breath. If you get to feel that the conversation is fruitless, leave it. I just saw something in the paper last week. It was a suggestion for Thanksgiving where family members with like very different opinions are going to get together. Don't argue with that aunt or that uncle or that sibling when you see they're entrenched. Leave it. Don't argue with crazy.
So if you're at a holiday gathering or any other time, and if you're engaged in a discussion which begins to be real clearly a situation where someone isn't going to listen or wants to argue or isn't taking in what you're saying, you may even feel yourself getting a little anxious or agitated. It's perfectly okay to stop
Leave.
that conversation, leave.
Yeah. Oh, it's been a pleasure talking with you. I'm going to refill my cup, because it makes you crazy to argue with crazy. So some of it's like discretion is the best part of valor. Don't go there. It's okay. You don't have to go to the mat with every political discussion or any family discussion. That when you get the sense that you've hit that stone wall, stop banging your head against it. You'll get a headache. Time to go.
Yeah. I think that's wonderful that you give people permission, encouragement to do that. I can just imagine someone's anxiety going up, feeling traumatized, maybe remembering things from the past with that person who's being argumentative.
Right,
And then the permission just to excuse yourself or walk away or go refill something. Wow, feels like a relief to me.
right. So I'm paraphrasing something someone once said to me. No one has put super glue on your tush. So if you are in an environment that is belittling or just crazy making, there is no super glue on your tush. Get up and go, which I thought was great advice.
That's terrific. Can it be as far as a kitchen or even
Absolutely. And
what are
that's why bathrooms were invented.
the
And when you are a woman of a certain age, you always want to know where the bathroom is anyway. So it's okay. Take a pee break. Just leave.
Uh-huh.
And then the one, how to stay sane in a crazy world, which is my favorite. I have to tell you, it's optional because not everyone can do this one. Get a pet, get a dog, get a cat, get any animal that you can hug. I don't know about lizards and frogs, and maybe for some people they do it, but I tend to stick with the mammals. So I think that's a grounding way to stay sane in a crazy world.
I think that sounds very hopeful. A lot of different hopeful ideas. And I think one risk these days is to lose hope, to feel hopeless and even
That's true.
I think it's wonderful for you to give ideas for hope and ways to stay sane or ways to stay hopeful even.
Right. If you spend too much time on the big mega questions of the universe, you can't solve them. Our sun is going to go dead in X number of years. I can't worry about that. That's not in my lifetime. So I think for the time being, I'm hopeful that the sun will come up tomorrow. And that's kind of where I have to shift my focus, again, shrink it down on the part that I can control, which is the sun will shine tomorrow.
There's something about, I think, the way you believe in a person when you give them, him or her, these ideas for behaving in a way that can bring them hope. It signals to me that they might feel a sense of confidence that you believe they can do it so that they would want to try to do it. And then, when it's successful, just, keep on trying and succeeding.
If you remember back, like in graduate school, where you learn about behavior modification, and you take an animal and you train them one incremental step at a time. Sometimes the struggle is in making it small enough so you can guarantee the animal's success the next and the next and the next. I suspect not only do we do that with animals, but we do that with ourselves. That whatever your long-term goal is, break it down into smaller and smaller steps. You want to try to guarantee success in whatever the next step is. And the next step. If you try to swallow the whole thing in one big gulp, not going to happen. But we all know this. How do you eat an elephant? The answer is
One bite at a time.
A plus.
Deborah, thank you so much,
You're
Doc.
welcome, Marty. It's been a
Really,
pleasure being with you.